security challenges, in our opinion, seem to have overwhelmed our security institutions.
The governors are supposed to be the state security officers of their state.
There is need for us to at least engage the traditional rulers.
We need to do something about our porous borders.
We have to own it from the unit level to the ward level to the local government to state.
Mr. President, the importance of today for us is for us to take action.
Those in favor say aye, those against say nay. The ayes have it.
This is Inside the Senate, and I am Hussaina Amina Aboki, your anchor. Welcome to this episode. As the Senate continues on its recess, we shall be focusing on some steps it has taken towards addressing some of the issues in the health sector while increasing the access of the ordinary Nigerian to health care. We also have reports of current happenings in the National Assembly, where some committees have been meeting to tidy up issues. Along this line, we will bring you a report of the graduation ceremony of participants of courses organized by the National Institute of Legislative and Democratic Studies (NILDS), as well as a public hearing organized by the Senate Committee on Drugs and Narcotics. Details of these and more when I return after the break. Don't go away.
The Senate will send a message to the President
to reap opportunities from that agreement.
Raise a matter of urgent public importance, and we are aware that when this particular motion comes up
for a longer term development, arise to second the motion.
Those in favor of this prayer say aye, those against say nay. The ayes have it.
Welcome back. Before we review efforts of the Senate towards enhancing healthcare delivery in Nigeria, let's take the report of the matriculation ceremony of 86 students of courses in legislative studies organized by the National Institute of Legislative and Democratic Studies (NILDS) in collaboration with the University of Benin, which took place last week, precisely on Monday the 15th of August 2022. Senate President Ahmed Lawan, who is the chairman of the governing board of the institute, was represented at the matriculation ceremony by Senator Degi Eremio.
It is gratifying to see how the institute has been faithful to many of its programs and activities, including workshops, seminars, and induction programs. Your zeal in broadening your understanding of legislative procedures has no doubt helped in improving the efficiency of lawmaking. This is commendable, as it is in line with our focus on sustainability towards growing our knowledge base. It is on this note that I wish you all well. God bless you all. God bless the Federal Republic of Nigeria.
Chairman of the Institute Governing Council, His Excellency Senator.
In his statement, the Director General of the National Institute of Legislative and Democratic Studies (NILDS), Professor Suleiman Abubakar, disclosed that participants would undergo courses of studies that would qualify them for the award of master's degrees, postgraduate diplomas, as well as higher national diplomas in legislative studies, elections and party politics, parliamentary administration, as well as official reporting. He added that parliaments of other African countries have developed interest in the activities of the institute and already following its footsteps.
The Parliament of Benin Republic has established a parliamentary institute model on NILDS. A delegation from the parliament visited the institute a few months ago to understand our system and learn from our own experience and success. Similarly, we have received parliamentary delegation from various African countries, including Ghana and Uganda, and just recently, the regional parliament of Ethiopia approached us for a benchmarking visit due to hold at the end of this month. The Institute has continued to show leadership in both research and teaching. And only recently, a delegation from Federal University of Lokoja visited the Institute for Academic Collaboration, especially at the level of PhD.
The participants, who are already staff members of the National Assembly, would undergo distant learning processes to earn awards and qualifications that would enhance their positions in the nation's parliament. In another recent activity, the Senate, through its Committee on Drugs and Narcotics, has stepped up its efforts at curtailing drugs abuse and misuse amongst the Nigerian youth. Partnering with its House counterpart and in collaboration with the National Association of Nigerian Drug Monitoring, NILDS, the committee engaged stakeholders at a public hearing in efforts to fashion ways of tackling drugs abuse amongst Nigerian youth. Let's take a report of the meeting as compiled and presented from our studio.
The public hearing, which took place on Tuesday the 9th of August 2022, was coordinated by the clerk of the committee, Mr. Isa Garba, on behalf of the chairman, Senator Hezekiah Dimka, and other members. The theme of the engagement was Zero Tolerance to Drug Abuse and Trafficking in Nigeria. In a goodwill message, Senate President Ahmed Lawal stated that the fight against drug abuse is also a fight against insecurity, as according to him, the misuse and abuse of drugs are the catalysts for the fueling of violent crimes like insurgency, terrorism, kidnapping, banditry, as well as other forms of crime and criminality in the land. The committee chairman on his part stated that they will work in collaboration with all stakeholders to ensure that drug abuse and misuse are reduced to the barest minimum in Nigeria. The Secretary of the National Drug Law Enforcement Agency NDLA, Mr. Shedrack Haruna, who represented the chairman, retired Brigadier General Buba Marwa, alongside other stakeholders, agreed with the committee chairman, while also calling for the involvement of all Nigerians in the fight against drug abuse.
Indeed, drug problem affects everyone, not just those people who are taking it. So that is why it is on every one of us here to join hand and fight this menace of drug trafficking and drug use. The work of drug prevention or drug enforcement is not just for NDLA alone. What it requires is coordination. If all of us in this room coordinate our powers against drug, I think we'll be able to stamp out this menace from our country.
At least 20% or 30% has contributed of drugs-related issue has contributed issues in this country. You can see insecurity, unrest in our country. Drugs contributed a lot. And this project is not only one person's project. It should be a collective effort. We should all join hands to fight this menace. You know what causes this mostly is peer group. Some people, some friends can lure their own friends into this kind of a thing. So monitor your children very well.
If we collectively tackle drug abuse from our society, crime rates will reduce to the barest minimum, which will be beneficial to all of us.
Personally, I've had experiences working with violent extremists under the European Union for 5 years. The major issues, drugs. 70 to 75% of those interned, drugs. For us to succeed in this fight, all of us must be involved. And when all of us are involved, it means there will be decongestion in our prisons.
If you talk of drugs, every negative vice is associated with drug abuse. Call it trafficking, call it rape, call it vandalism, call it violent extremism, call it whatever thing you know that is on the left side. It has a link with drugs. And so I want to appreciate this committee once again and thank the organizers of this event in bringing this drug fight to a logical conclusion. God bless you.
Other dimensions to the subject matter are the use and abuse of technology at home, as well as the involvement of security agents.
The internet facilities and others that we have at home, how do we use them? Are we using them to build our children positively? Are we using them to affect them in a negative way? Parents don't know what the children are doing with their phones at home. If they are watching pornographic movies, you don't know. If they are being trafficked with that phone while you're at home with them, you don't know. Coming here today is a clarion call that we should use our technology in a proper way.
If you go to the street now, you see in every week you see people running mad, both men, both women. It's all, they say, because of drug intake. Have you seen anybody who have taken drugs and become normal? I still want to beg. We, the agencies that are fighting this issue, all our hands should be on proper desk. Some of us are tolerating certain abnormal characters. Some of us will take because of money. Recently, in our side, we saw a vehicle full loaded with tramadol, ice, and all sort of illicit drugs. Did you know that the person escorting this load is a uniformed man? Is it not a very bad example?
The Attorney General of the Federation and Minister of Justice, Mr. Abubakar Malami, represented by Roslyn Tasha and other stakeholders, offered suggestions, adding that the fight against drug abuse must be all-inclusive.
It's not just for the parents alone, for the teachers, for the neighbors, for the churches, for the mosque, that's the imams. All faith-based organizations should be involved. All of us seated here must all be involved. We all concur to the proverbial phrase that charity begins at home. The parents should be on the lookout for presence of drugs and their paraphernalia like foil rolling paper, mirror, straw, and blade. They should be conscious of drug odor, smell of incense, use of strong perfumes and strong menthol sweet to dampen or obscure smell. We also to establish nurture good relationship with their children. That is leading by example. I as a mother, if I take drugs, my children otherwise will also follow in my example. To curb the menace of hard drugs, parents must allocate quality time to be there for their children.
If you permit me to say, I will say those of them that are supposed to hear this thing we're talking about are not here. Most of them are not here. So next time I want to advise, please, I want to encourage that when next such a program is organized, we take them outside, perhaps to the park, where people that actually use these things will get to hear and now learn lessons from them.
Also speaking, a representative of the United Nations Office on Drugs and Crimes, Mr. William Hu, disclosed their collaboration with stakeholders like the National Assembly as well as the judiciary to accord more powers to the NDLEA for effective performance of its duty.
And we also have helped the High Court judges to check the sentencing guidelines on the drugs offenses. And our office, in close partnership with the National Assembly and NDLEA, the experts reviewed the acts of the NDLEA. I hope that this new acts will be passed by the Senate, by the Assembly very soon, so that we have very brand new reviewed acts, so that our drug control efforts will have more legal evidence-based, and our drug control works for Nigeria will be better done.
Those were reports of recent events unfolding at the National Assembly. As the recess continues, inside the Senate will endeavor to bring you events that unfold. For now, let's pause to open our notebook. Stay tuned.
Legislative immunity is provided for in the Legislative Houses Powers and Privileges Act to protect legislators of both the National and State Houses of Assembly from litigations for actions taken during plenary, committee duties, and oversight, among other things. It is designed to strengthen the power of legislators to carry out their lawmaking functions without fear or favor.
Welcome back from that timeout. Like I mentioned at the beginning, we shall be reviewing legislations and actions of the Senate in various sectors of the country. Our focus this week is on some of the interventions by the Senate to enhance the health of Nigerians. One of these was the National Health Insurance Scheme NHIS Act 2004 Amendment Bill 2022. The bill scaled second reading on the 12th of December 2019 and third reading and passage on the 23rd of April 2021. However, Assent to it was declined by the President, who recommitted to the Senate on Wednesday, the 1st of December 2021. Report of how the bill progressed and other health-related matters are compiled and presented from our studio. Keep watching.
The Senate, in the Committee of the Whole, considered the National Health Insurance Act.
The reconsideration of the NHIS Amendment Bill followed its recommittal to the Senate to address some fundamental issues. It was represented by the Deputy Senate Leader, who gave further clarification.
After critical examination of the bill by the President, Commander-in-Chief, some fundamental issues will require fresh legislative action on the following clauses 20, 24, paragraph 2, and 25, paragraph 2c were raised.
Accordingly, the Senate rescinded its earlier passage to address the clauses in the bill which had to do with appropriating funds to cater for Nigerians who cannot afford the scheme and therefore categorizing them as vulnerable group. Senators gave suggestions on the way forward.
I think the amendment, as we discussed earlier, should just be money that may be appropriated. I think it's just to remove the word allocated to the vulnerable group fund, and it stops there.
More than 70% of Nigerians are poor and they don't have access to insurance. They are not in job. We want certain kind of money. That's why that tax was created. But because it is not in line, I want to suggest, Mr. Chairman, support your suggestion that it should be in special intervention fund appropriated by, we can say appropriation by the National Assembly, but it means it's a special fund, but I want allocation to be there as well by government and appropriated.
After several other observations, the bill was considered clause by clause, leading to third reading and passage. As it were, the bill was assented to by President Muhammadu Buhari on the 19th of May 2022, with one of the amendments being a change of name from the National Health Insurance Scheme (NHIS) to National Health Insurance Authority (NHIA). The agency will have the following amongst its mandates: making health insurance mandatory for all Nigerians, including employers and employees in the public and private sectors with 5 staff and above, as well as limiting the scope of health insurance organizations, HMOs, as against the old act, which empowered them to collect and implement contributions for premiums, including payment for services to healthcare providers. Still towards providing healthcare delivery, the Senate considered the National Health Act No. 8, 2014 Amendment Bill 2022, sponsored by the Chairman, Senate Committee on Health, Senator Yahaya Oloriegbe, and presented for second reading before the recess on the 1st of February 2022. Similar to the NHIA bill, the sponsor stated that the bill is necessitated as a result of the recent emergence of a global pandemic and pockets of outbreaks across the country. It also seeks, amongst other things, to ensure seamless operation of the National Council on Health and strengthen Nigeria's capacity to adequately prepare and respond to diseases outbreak as well as public health emergencies. The sponsor gave more clarification on the bill.
This bill is proposed to provide for the role of private sector in the healthcare services in order to improve the private sector participation in the health sector, to empower the permanent secretary of the ministry to preside over the affairs of National Council in the absence of the minister, to provide for health security and review basic care health fund provision and for other related matters.
When the COVID broke all over the world, we found out in our country that we were never prepared for it. All the issues, all the infrastructure, and all the provisions that we have made over the years were rubbished by the pandemic. And then, of course, there was the need now to start providing funds to be able to meet up with the challenges that we had as a country. To drive health needs of our people, we need to put everything together, both the public and the private sector. This is what we need.
The amendment is just focusing on 4 areas, and I think if we all support this bill, it will go a long way in ensuring that the objectives of the Universal Health Provision Fund is achieved.
The bill scaled second reading and referred to the Committee on Tertiary Health. Also presented for second reading on Wednesday, the 20th of February 2022, was a bill for an act to establish the Federal Nephrology and Kidney Research and Treatment Center, Hadeja. It was sponsored by Senator Ibrahim Hadeja. In his lead debate, Senator Ibrahim Hassan disclosed that studies have revealed that Jigawa and Yobe states have the highest prevalence of kidney disease. He highlighted the extent to which they are affected, as revealed by studies conducted by some research institutes.
Another study conducted by NILDS, that's the National Research Institute for Chemical Technology Zaria, in 2015, confirmed the abnormally high incidence of CKD in the Hadeja Valley, with a prevalence that is 3 times the national average. The study also confirmed the presence of heavy metals and other environmental toxins in the water supply and in the sample liver of local livestock and poultry. This is why the siting of a kidney research and treatment center in Hadeja becomes imperative. There is an urgent need to locate a center of excellence dedicated to establishing the causative factors and treatment options in the renal disease epicenter of Nigeria for the benefit of kidney disease patients nationwide.
Senators supported the bill.
Hadeja and Yobe states came up as a very, very epicenter for this disease. Therefore, establishing a kidney center that will carry out research that will not only focus on treatment, but on prevention, which is key in modern medicine today.
We need to spread such specialized hospitals across the country. Nigeria is a vast country. And I know if we have this center in only Hadeja area, it will attract patients from across the country.
The bill then scaled second reading and was referred to the Senate Committee on Health to report back in 4 weeks. The chairman, Senate Committee on Health, in an interview, gave a summary of some of the committee's actions on health matters generally.
As National Assembly, we've tried to do our best to get the country going, to provide good governance. We are doing this not without challenges. Of course, the country, just like many countries in the world, is facing security and economic challenges. The economy, I would say first, because of the pandemic, the world economy has been in crisis since 2020 because there were lockdowns, so there were no activities that will enable generation of resources, and particularly for Nigeria. And this has increased poverty, has increased agitations and so on in many countries in Africa, which came down to Nigeria, and as such Nigeria is also sharing from that.
The program is Inside the Senate. We will now take our profile segment. Please stay tuned.
Senator Godia Akwashiki represents Nasarawa North Senatorial District under APC. After primary school in 1987, he proceeded to Government Technical College Asakio in 1988 for his senior secondary school certificate in 1993. Senator Akwashiki obtained a Bachelor of Science degree in Business Administration from the Nasarawa State University, Kefi, in Nasarawa State in 2010. On the political turf, he was elected member Nasarawa State House of Assembly, where he served 2 terms, first from 2011 to 2015, during which he was majority leader, and from 2015 to 2019 as deputy speaker. He contested to the Senate in the 2019 general elections under APC and won. He is currently the chairman, Senate Committee on Labor and Productivity, and a member of several other committees. His legislative interests include education, agriculture, and youth and women empowerment.
This brings us to the end of this episode of Inside the Senate. Like I promised, we will continue to bring you reports from the Senate wing of the National Assembly as they unfold during this recess, as well as review legislations deliberated before the recess. Join us next week for another edition, and thanks for watching.